And welcome back. Well, for almost 10 years, Genesis World Mission has been working with a network of partners to help the Barangi community in Kenya. Genesis World Mission is working on a health center for the Barangi community, and they need your help to get it done. I'm joined by the International Director of Genesis World Mission, Tracy Ritter. Thank you so much for joining us this morning.
It's my pleasure. Thank you.
All right. Well, you've been part of this organization for a long time. Tell us a little bit about Genesis.
Well, Genesis World Mission, our main office is actually located in Boise, Idaho. I lived there for 10 years, but I work for them remotely here in Maryland. And we do a variety of community development work locally in Boise for the uninsured and underinsured patients. We have a medical clinic there, and we work in Kenya, also working with the poor, and our focus is in community development.
All right. And what particular project are you working on right now in Kenya?
So of several projects, one is the completion of the Barangi Health Center. In this community, given its remoteness, the access to health care is limited to really non-existent for a community of over 4,000 people.
Wow. Okay, so you've been working on this for a long time. How long have you been part of the organization yourself?
I've been with Genesis since 2002 in a variety of capacities, but primarily within our international work.
Can you explain the type of team it would take to do a big project like this and what it's like working with others at Genesis?
Well, our organization is a small nonprofit, and we work diligently to keep our overhead down so that all the donations go into the actual projects that we are implementing. And so my role has been, my background's in nursing, and I have a master's in public health, so a lot of it focuses on the healthcare aspect. But again, in Kenya, we are looking at a variety of community development projects.
Have you heard anything back from the Barangi community itself and what they think about what's going on?
Well, I have really the pleasure of going every 3 to 4 months. I've been doing that for years, and so I have a very personal connection with them. We've developed a formal partnership with the community themselves, and that's what makes our work very unique, in that our approach, our process is done in such of a way that the community is the center, is the focus of that work. And so our partnership with them is a formal partnership, but the Kenyan culture is very personable. And so again, I get to spend quite a bit of time with them on a regular basis.
And the travel to that country, it has to be an amazing feeling to see what's going on and to see something you've been working hard on to be accomplished.
Absolutely. You know, the whole continent of Africa is a beautiful place, but more importantly, the people there that I've had the pleasure to work with, and other organizations as well, for probably 16, 17 years now. The people in Kenya are very deserving, very hardworking, and resilient people who have an amazing set of skills that I think sometimes that we think because people are poor that wouldn't be the case. But they have been instrumental in all the projects that we are working on, especially this healthcare center. Right,
and how important is this healthcare center? What are some of the things that people of Kenya can receive and get that they're not getting now?
Well, of course, treatment of illness, but our focus, one of our main focuses there is education and prevention, because many of the things that they suffer from can be prevented. And so they are very hungry to understand, for instance, how and why you get malaria, and how you can, what you can do, and so that you don't have to suffer from that illness. When we interview a patient for the first time, the question is, when have you had malaria last, not have you ever had it? And so this healthcare center would be a place they would come for treatment, for education, children for immunizations, women, of course, that are expecting or pregnant, so maternal child health care will also be a big focus.
Okay, so there's crowdfunding that has been set up. Is that how the public can get involved and fund the actual health center?
Absolutely. Crowdfunding is a relatively new concept. Many people have heard about Kickstarter. This particular platform is called Indiegogo, and it is designed for nonprofits such as Genesis World Mission to really get out into social media, if you will, the initiatives that we're working on. And so we're raising the last bit of funding required to finish this health center, and so the goal is $15,000. And so as of today, we're close to about $6,000, and the platform will be open until March 4th.
And that's the big way the public can help. By
Absolutely.
Going through there.
It's an easy way to go online and go to the campaign that we have launched, and it's pretty much a click of a mouse, and you can donate any level. And the concept is getting lots of people's attention, and so we have had success in getting people involved who otherwise would not have known about this project.
Right, and all the money that you do raise with this and that people can donate, it goes straight to this project?
Absolutely. 100% of that donation goes into literally the bricks and mortar, because the community members themselves are building this clinic. They have the expertise in building and construction. Of course, we have a contractor overseeing that. But yes, those donations are 100%, and of course tax deductible as well. Okay. And you will get an email notification for your tax records for it as well.
Well, you are doing a huge thing for the community of Kenya, and thank you for being here once again. Absolutely.
And the way to access that campaign would be to go to Indiegogo.com. And when you go into the platform, you can, or the campaign, you can look for the Kenya help raise for 4,000 people access health care in Burangi.
All right. Is there a phone number, or is the website the biggest thing that they can do?
The website is the best thing, yes.
All righty. Well, thank you so much for being here this morning.
All right. Thank you.
All righty. Stay with us. We will be right back.